Paris on Politics from Fox 32 Chicago.
It's Monday after July 4th, which means NASCAR is driving out of town and Grant Park is set to open back up to the public for like 1 or 2 days before Lollapalooza comes in and closes it down again to set up for that festival that takes place in about 3 weeks. And then by the time the Lolla cleanup happens, Grant Park will open once again, just in time for September and summer to dissolve into fall. Now, we don't have an official list for this year, but Block Club reports that last year, Grant Park was closed for 73 days during the summer between May 15th and August 11th for events like Lollapalooza, NASCAR, and Sueños. Now, remember, when civic leaders of yore declared that Chicago's lakefront would be forever free and clear, they forgot to say, yeah, only if you pay for a wristband. Now, this weekend, I paid a visit to our neighboring city 2 hours to the north for a couple of Leinenkugels and a few laps around their great annual music festival, Summerfest, held on a permanent festival space right on the lakefront. Too bad Chicago can't do something similar. Wait a second. Chicago also has a lakefront and tons of open space right near downtown. Remember that proposal to build a giant new Bears dome on the parking lot south of Soldier Field? Yeah, that ain't happening, but perhaps planners might turn it into a big public festival space, a la Summerfest in Milwaukee, anchored by Soldier Field, which come a few years from now is going to be looking for something, anything to host. It's far past time for city leaders to have a conversation about what its cherished public parks are supposed to be for. Recreation, sport, communing with nature. I love music festivals, but I'd prefer to enjoy them in a space built for music festivals. Park district leaders have said that these big events like Lollapalooza provide the necessary funding to improve our public spaces like Grant Park. But what's the point if the public only has a few days during the summer to access them?
Coming up on Paris on Politics.
Governor Pritzker selects a fellow Chicagoan as his running mate for a third term. We go one-on-one with Lieutenant Governor candidate Christian Mitchell.
It's the most popular bill ever signed in the history of our country.
The so-called Big Beautiful Bill. Advocates for Medicaid and food stamps say another B word better describes the bill's cuts. Brutal. We break down how the bill stands to impact Illinois.
This is Paris on Politics from Fox 32 Chicago.
Welcome to Paris on Politics. Hope you enjoyed your 4th of July weekend. If you were away or stayed off the phone for the entire weekend, kudos to you, but you might have missed President Trump signing his massive spending and tax cut bill called the Big Beautiful Bill into law after last-minute arm twisting, and that was to get skeptical Republicans who were worried about how much the bill would add to the deficit on board. So here are some of the highlights of what was signed into law. The Congressional Budget Office estimates it would kick 8 million Americans off of Medicaid in the next 10 years. It would cut food stamp benefits like SNAP that could impact $40 million, and expansion of child care tax credits, 40 million people that is. It would also expand child care tax credits and real estate tax deductions, and an estimated $3.4 trillion added to the debt over the next 10 years. And joining me with more on the impact to Illinois is Jim Conwell, Vice President of Marketing and Communications at the Great Chicago Food Depository. Jim, thanks for joining me. So about 2 million people receive food stamp benefits, SNAP, in Illinois. How many would be impacted by this bill?
Well, in the short term, the effect of the bill could limit eligibility for at least 360,000 people in Illinois in the months ahead. And it would do that through a tightening of work requirements. So it would mean that any adult receiving SNAP who is between the ages of 18 and 64 who does not have a child under the age of 14 would be subject to new work requirements. They would have to report working at minimum 80 hours per month. So that could short-term impact or very quickly impact as many as 360,000 people.
And how about long-term?
The longer-term impact is a little scarier, but more unknown, because further down the road, one of the ways this bill, now law, will limit SNAP funding is by requiring states to pay a significant portion of SNAP benefits, about up to 15% of SNAP benefits, whereas in the past, SNAP benefits were entirely funded by the federal government. That takes effect in 2027. So that's a little further off, and we've yet to calculate the total impact of that. But what we do know is for most states can't afford to do that, including Illinois. You've cover all the time the fiscal challenges that our state faces. And so this is going to require Illinois to make really difficult decisions about funding their new share of SNAP benefits versus other essential things like healthcare, education, transportation. And those are all essential needs.
And I know Governor Pritzker has put the total tab at around $1 billion for the entire bill and its impact on Illinois. So for these 360,000 Illinoisans that might be affected in the coming weeks and months, what recourse is there for them?
Well, we encourage people, if you're on the program, stay on the program. SNAP is our nation's most effective anti-hunger program, and it has been for decades. They will probably receive some communication in the near future about how they report work hours and what the work requirements mean for them. Beyond those 360,000, though, pretty much anyone who's on SNAP, we expect, will have to go through this reporting process, even if they are working, which it's just another burden, another bureaucratic hurdle that people need to get over on a regular basis to get on SNAP and stay on SNAP.
And what does it mean for food pantries like those that you work with at the Greater Chicago Food Depository? Are they ready for more potential customers and folks in need?
I wish I could say that we're ready and we're equipped for this, but at this moment, we are not. The Greater Chicago Food Depository partners with and supplies more than 800 organizations throughout Chicago and Cook County. We're serving more people now than we were before COVID still, due to the high cost of living, the lingering impacts of inflation, and a safety net that was already too small. So we're worried that this is going to cause an increase in demand above and beyond anything we've ever seen before. I can promise you and the viewers, we will do everything we can to make sure that our partners, food pantries in every neighborhood, are supplied to serve anyone who walks through their doors, but it's not going to be easy and we won't be able to do it alone. We're going to need the public to continue to step up and support our mission, support their neighborhood food pantry, support the food bank where they live, because the need's only going to get greater from here.
All right, a lot of difficult decisions ahead and some good advice for folks receiving those SNAP benefits right now. Thanks very much for joining us, Jim Conwell from the Greater Chicago Food Depository. We appreciate it.
Thank you, Paris.
And for more on how this impacts Medicaid recipients in Illinois hospitals is A.J. Wilhelmi, who is president of the Illinois Health and Hospital Association. Thanks for joining us, A.J. Wilhelmi. So you heard the dire predictions there from the food stamp point of view. What about the Medicaid point of view? And as I understand, there's more than 3 million Illinoisans that receive Medicaid benefits. How many will be impacted by this?
Yeah, Paris, 3.4 million Illinoisans are covered by the Medicaid program. We anticipate hundreds of thousands of Illinoisans will lose coverage because of the bill that was signed into law on Friday. Obviously, that'll have a devastating impact on vulnerable residents across the state. And of course, it's also going to have a very important and significant impact on the providers and hospitals that care for them.
So vulnerable residents throughout the state, are there specific populations that these cuts are going to hit the most?
When you think about it, it's our senior citizens, it's the elderly, right? It's children, it's families. You know, 1 out of 2 deliveries in this state is covered by Medicaid. And so we know this is going to have a devastating impact on families across the state. And of course, our hospitals are very concerned with over $2 billion in federal Medicaid cuts here in Illinois on an annual basis. That's at a time when hospitals are already facing significant cost pressures coming out of COVID. and having a very challenging time maintaining services, maintaining jobs. Some of our hospitals are on the brink of closure.
And I want to get to the impact on hospitals in a second, but for the folks that might be vulnerable here to losing their coverage, what can they do to ensure that they'll keep it amid some of these new work requirements that'll go into place?
Yeah, it'll be very important, obviously, with respect to the reporting requirements. We're going to take a hard look at that. We certainly don't want to have the unintended consequence because of these reporting requirements of people, improperly losing Medicaid coverage. We're concerned about that. So we're going to be closely watching this and also having conversations with stakeholders as well as our elected officials, both at the state and federal level. As we look at some of the out years and the implementation of this bill, the reporting requirements, as you heard from Jim, with respect to work requirements is something that we're going to be tracking very closely and looking for opportunities to make sure that this is rolled out and implemented in a way that doesn't have those unintended consequences.
And you mentioned, potentially $2 billion a year lost in reimbursements for Illinois hospitals. Is the state going to have to think about making up for that shortfall? And we know the state has its own budgetary issues. It just closed a $3 billion budget gap of its own this year.
Yeah, Paris, it's a great question. It's really an important policy discussion that will have to be had. We want to certainly be part of that discussion with the administration, with legislative leaders. But when you think about it, when we're talking about this level, this scope of Medicaid cuts, it's inconceivable to think that the state will be able to backfill this level of cuts to the Medicaid program. But we certainly want to work in partnership with the administration, with the legislative leaders, and really the entire General Assembly to assure that we protect this program as much as we can. This is a lifeline for 3.4 million Illinoisans. And certainly the healthcare coverage, which results in access to healthcare services, critically important for the health and well-being of those folks. And so we're looking forward to that policy discussion.
All right, so you mentioned $2 billion potentially in cuts to Illinois hospitals. What hospitals right now are vulnerable to closure as a result of this?
Yeah, it's an excellent question. We know that there are a number of rural hospitals that were identified in a study that came out of North Carolina. In fact, they identified 9 hospitals in rural Illinois that would be in a position to close because of these cuts. We know that there are safety net hospitals serving urban communities that are also very vulnerable. And frankly, all of our members in the Illinois hospital community, when we talk about service lines and access to those services, they're going to have to make some very difficult decisions because of the magnitude of these cuts. And so we're certainly going to be in conversation with our membership, rural hospitals, hospitals serving urban communities, and the entire hospital community to help support them at this very critical time so they can care for and support their patients and communities.
And you mentioned it's not just rural hospitals, but urban as well. Cook County Hospital here serves a vulnerable population, a huge Medicaid population. I interviewed them a couple weeks ago, and they talked about the loss of the health care program for immigrant adults. That's going to cost them about $100 million. What do you think this added cut in Medicaid will cost a hospital like Cook County?
I mean, it could be tens of millions of dollars, right? We're still reviewing the bill. We're still thinking through the implications to our membership. I mentioned the $2 billion in lost federal Medicaid funds for hospitals and other providers, but the vast majority of the cuts come at the expense of hospitals. And so we're going to think through that, but I could see a Cook County Hospital, it having an impact of tens of millions of dollars, and certainly, hundreds of millions of dollars for hospitals across the Chicagoland area. And certainly the same magnitude of cuts when you look at the rest of the state, central Illinois, southern Illinois. So these cuts are dramatic. They're going to have a devastating impact on our patients and also on the hospitals that really are there for them 24/7 to make sure that they have access to quality healthcare services to lead productive lives.
And that's, the thing, when we talk about hundreds of thousands of folks losing their health care coverage, what does that mean for them? Does that mean they wind up at the emergency room for charity care, for things that perhaps they could have had treated in a more holistic way with coverage?
Yeah, we have a moral and legal obligation to care for everyone who comes through our doors. We're going to continue to do that. But to your point, this bill will result in a drastic increase in uncompensated care. And at the end of the day, that puts added burden and pressure on hospitals. And again, they're going to have to make tough decisions around service lines, around jobs, community programs. And as you said, Paris, some of our hospitals are going to be forced to close.
All right, AJ Wilhelmi, very ominous forecast there. We hope to talk to you in the weeks and months ahead as this bill goes into effect and we see the implications of it. Thanks for joining us.
Thank you, Paris.
And when we come back, one-on-one with Governor Pritzker's new choice for running mate, Christian Mitchell.